who had died in many cases, and we would redistribute them. We would get together under the guidance of a nurse at the time who was very knowledgeable about these things. And then we would actually send people out onto certain corners of the city to meet other people to give them medications that they did not have access to.
That's right.
And that was not easy, and one of the reasons why it wasn't easy was, I mean, first of all, we were doing something that we probably could have gotten in big trouble for at the time, but also because one of the other unique things about Newark, and I think about cities like Newark in general, is we sort of encountered the complexity of people's identities. For example, many of the people that we worked with, the men particularly did not identify as being gay. There were men who had sex with men. And we had to learn to respect that category instead of saying all the usual things like, oh, just stop it, you know you're really gay and you need to come out of the category. We had to accept and understand, try to understand what people's sexual and gender identity was, and that it wasn't going to fit into the neat categories of sexual orientation that we had been culturally conditioned to think this is how it works. That wasn't how it worked. It was a lot more fluid, it was on a continuum, and this was not only about what the nature of people's sexual practices or desire was, it was also about their gender identity. And unless we could factor those elements in, and we had to figure out how are we going to reach these human beings, and we realized we have to let go of all of our conditioning. And this was regardless of what color your skin was, what your class was. This was a real issue for reaching people in Newark. It wasn't New York City, even though New York City is only 11.5 miles away. You know, for many people in Newark, gay identity meant white, bourgeois, privileged, middle class, not who many of the people in Newark were at the time.
I think that was like part of my job, was to break this down. Sex had nothing to do with male, female, men having sex with men, women having sex with women. It had nothing to do with it. Sex is sex, and as the song used to go, you love the one you're with. So it didn't really matter what you choose, you know. And here we are dealing with a devastating disease, and people want to separate people into categories, and that's not the way sex works. It's however you feel at the moment. At least that's the way it was then, before this devastating disease came along, and then we had to change some things. But Peter is absolutely right, that there were men that were having sex with men. It was just a good feeling that they were having. They didn't identify as
no, because as soon as they were done,
right,
it was done. It was no, oh girl, I'm gonna meet you at the club. Right. It was like, no, you never met me, and I just happen to have sex with you, and
I got to
done.
go home to my girl and 3 kids.
Right.
Yeah.
Right. So
and I think that's something we don't talk about in African American cultures or the Latin cultures a lot, about bisexuality. You know, we were so repressed. Well, I wasn't repressed, but people were so repressed with sex. And to me, I was lucky I came from a household where we talked about sex and healthy sex and all those things.
Right.
So when I saw people doing things, I would be like, oh, you don't have to do that. What you should do if it's painful, try it this way. And they were like, how you know? Oh, me and my mother looked it up. My mother would bring home books to me. And that was my thing, so that was my advantage in the situation. But I don't think that I get upset when I hear people say we want to talk about AIDS, the AIDS epidemic, and don't talk, and keep it happy. I have to talk about the pain.
Right.
I was sitting up here crying inside this. I'm sitting here thinking about all the people I've lost. So to me, it was genocide.
Right.
Ronald Reagan represents genocide to me. Koch represents genocide to me. I remember watching nurses laugh at people dying from AIDS, making jokes. I remember those things. I remember people saying, "Oh, bitch, you're gonna die soon," and that was the joke. That was the ha-ha. That was the hit. I'm like, well, that ain't funny.
That's right.
know.
And you get what you deserve.
And you
with
get
the
what,
other
oh,
people.
well, that was from them, the church and everything. And before we go any further, I just want to talk about the black church.
Oh, please.
Oh, gee.
That's another stuff.
She has a question, but let
Oh, don't get me started.
Go ahead, honey. Because we gotta have church up in here, so you better go ahead and ask your question.
I was just wondering, like, before you knew it was AIDS, what was the conversation in Newark? What did people think was going on? Like, as we started getting sick and dying.
Nobody knew.
Nobody knew. As I said, where I worked at the health department, there were a couple of people there. I don't know, one of the gentlemen had been an IV drug user, but had changed his life up and was doing very well. And one of the other gentlemen used to come to the clinic just to be tested. We had no idea all of a sudden just became sick. And you could see him, like I said, deteriorating before your eyes. He would go to the doctor and they couldn't tell him what was wrong. And that was like a mystery, because you could see that things weren't right with him, and he would say, the doctor doesn't know what's wrong with me, it's just happening. But now when you think back about it,
And the weight loss was so
and the weight
great.
loss was devastating.
I remember
Well,
this
you know
queen
what?
told
You know what
us.
really brought it to their attention? You know who did more for HIV than anybody else? Yes.
Yeah,
And
Rock
Arthur-
Hudson, Rock Hudson, Arthur Ashe, and Lil Ryan White.
right.
I would go with Ryan White and Rock Hudson. Arthur Ashe, he was there. He was Arthur Ashe, what a nice guy. But Rock Hudson had their asses full. And
Yeah, because the women was bored.
Yeah, and I think that's what really messed.
Saying all that was running to the hospital.
Yeah, and that's what really had
What was
that
the
going.
woman on
Dynasty.
On Dynasty,
You
yeah.
didn't
What was
wanna
the one
kiss
on
her.
Dynasty?
Joan Collins.
Yeah.
Not Joan Collins, the other.
The one with the blonde hair.
The one that was quick Joan Collins behind from messing with her husband.
But you know what also too? I remember somebody
Kristyn,
told
yeah,
me
Kristyn.
if you ate broccoli, you could catch AIDS. To me and my best friend. So, and my mother brought home some Chinese food, and she said, I brought you some chicken and broccoli. I said, no! Get it out of here, we dying. And my mother said, if you don't get this damn food up off the floor, because I really could see the rumors were so swift and everything, you didn't know what to believe.
The reason why I say Arthur Ashe is because it actually, the African American community actually had a face that they can connect it with. You know, and you know how the gay community is. I told you that child was gay. Okay, if he was gay, then you need. Whether he was gay or not wasn't the issue. But you know that's what they said. I knew Arthur Ashe was gay. Ain't no man with no afro like that named gay. You know, they always had to put something in
Yeah, they
there.
had
So
to
it
put
put a
something
face to it for our community. But Rock Hudson and that little boy Ryan White.
Actually, I think Ryan White's death actually broke kind of like the glass ceiling. It was allowing people to get help.
Get services.
Yeah, because if it wasn't for Ryan White, Ryan White was like the savior for many people.
Yeah.
But
Yeah.
also, just to answer your question as well, in those early days, we all were obsessed with our bodies. Every pimple, every sign of a cold, even an itch would think, oh God, I've got it, I'm dying. You know, I'll be dead by Tuesday.
Yeah. I stopped eating pepper on my food because I was scared to death to sneeze.
Yeah.
I said, Lord, they're gonna say something wrong with it. Because that's how it went on.
You know, University of California, San Francisco in 1987. And I remember hitting the wards of San Francisco General Hospital and seeing patients who were HIV positive from time of diagnosis, and we knew that you only had 6 months to live. And then in about 1998, I distinctly remember when the antiretroviral cocktails came along and we began to see people live longer. And then I can time it about the mid-2000s when I began to see patients, I was working at St. Michael's at the time, that had lived more than 20 years, 25 years HIV positive, where you would look at a chart and HIV positive with just 3 letters and a plus. We've come a long way, and I began to reflect that, you know, this isn't the first epidemic that this world has faced, that there's been remarkable medical advances. Like at one point, tuberculosis was considered the same way. We've had a mini one of those with the Ebola virus. And the thing that, when I listen to you all speak, that comes to mind is this tremendous history, and now being in 2015, where we have some data coming out showing that if someone is HIV positive today, and they get on treatment today, that the lifespan is near normal. It basically is normal. It's the same as someone who were non-HIV positive, where we have medications that have reduced the incidence of transmission of HIV to near negative. I mean, there's some studies coming out now showing that if you have two partners and one partner is HIV positive and they're on medications and their viral burden is zero, that they're actually not transmitting the virus. What's happened is this huge cataclysmic change and a younger generation of people who do not have the same fear of HIV. But the stigma is still there. They don't have the fear of HIV, but the stigma is still there. The homophobia is still there. They're still connected historically in communities where there was a maafa, there was a death, there was all this tragedy. And some young people connect with it and some don't. I have this question about the ball community today, particularly amongst the youth in the ball community, and I'm kind of sad that the youth have left. And I have this question particularly for Bernie. When you see young people now on the house walls and there's this whole kind of trend of barebacking or unprotected sex, you know what I mean, and the lack of fear of HIV, what goes through your mind?
What goes through my mind is I'm almost envious of them. I'm gonna be very honest with you. I'm almost envious that you could live your life without worrying about the fear of death knocking at your door. You know, I always hear people say, "Oh, you were a forerunner for all the things that came and all that." But to be honest with you, they're very lucky because they don't have to suffer the pain, the humiliation. It was so devastating. So when I see children today having sex bareback and it's a normal thing to do to some people, I don't go to them and say, you shouldn't do that. I tell them what can come with that. But my version of what can come with that is different from what it was for me when I was 17 years old. You understand what I'm saying? So to be honest with you, if I want to sit here and be honest with everybody, there's almost a little envy that they don't have to suffer. Like, damn, they ain't going through what we went through. You know, and I'm almost feel happy that they're able to have a sexual freedom and still live. Because they have things like PrEP, there's all these other things that they had. We didn't have those things. It's almost like we only had 3 channels when I was growing up, and everybody got cable. I'm like happy that, oh, you got cable, ooh. Am I a little jealous? I wish I had it, but it is what it is. I think that sex, much like America, we're growing, we're accepting, but there's something about us that we have to keep somebody lower in order for us to be higher. So, if anything, my problem with AIDS and HIV today with the youth is in the same connection with jobs, education, and all these other things. You understand what I'm saying, if I'm making sense? It's not, ooh, you shouldn't do that. Well, if you do that, this is what happens. And their first response is, well, I can get medicine. You couldn't.
You know what?
And they do say that.
I understand what you're saying. I understand what you're saying as well as Ishmael, but the morbidity report don't lie. Now I'm hearing what you're saying, and yes, they do have access to. They have access to more, to what we had back in those days. But the morbidity rate doesn't lie. They're still. Let me finish. They're still dying. They're still dying. They're still getting infected. Okay. The problem is, as far as where I said, is people aren't accepting the fact that they're dying. It's part of the disease. Now you don't see us running to all these funerals like we used to when they used to have when people died. I mean, the line would be from here all the way to City Hall. But I think we have to be very careful, even with that cocktail that they got out there. And I'm not saying I'm for or against the PrEP, but it's out there. And I think that PrEP is very misleading because I know that people are still dying. The numbers are still saying that the infection rates are going up. Okay, you might get 1 or 2 that's on that PrEP program, and the one's not getting infected. but let's not drop our guard and embrace the fact that we've come so far in this in our medical. Okay, and I, you know what I mean. I work in clinical research as well, so I just retired from clinical research, and I know that the morbidity rate continues to rise.
Yeah.
But it's also
and it's
mixed with
even
stuff,
rising
though.
quicker
Drug use.
with women.
Well, you do know that, like, one of my mentors was one of the pioneers in HIV treatment in the African American community, Dr. Robert Scott. I had a clinic in Zimbabwe where we were bringing older generation HIV medications to a population that didn't have condoms. And we were seeing that there was no perinatal transmission. We were seeing that there was, and we saw this because we were able to see it in a country where you couldn't see it in the United States because it wasn't allowed. Prevention was so strong here, and we weren't seeing the transmission. So there were things that we saw. The fact is now there's a big argument about treatment as prevention, and we know that when people's viral burdens are zero, that they're living, and we know that HIV now, the complications of HIV are ones of comorbidity, substance abuse, poverty, lack of medications.
Yes.
So the real divide now is the money. If you have money, if you have a job, and you have good insurance, and you can get to see a doctor and get medications, you know what I mean, your life expectancy would be great. But the problems in communities of color and dispossessed communities is that does not always happen. And so we still see the deaths. But we're seeing the deaths because of other things, like, people saying, why do I have to live anyway? I don't have a job. I'm depressed. Right?
Psychological.
Yeah, and so they're not taking medications. And they're allowing themselves to die. And I've seen this because I've worked at a lot of hospitals.
And we're also, but not to cut you off, Doc,
Yeah.
but also too, there's this thing like, I don't know if anybody knows if I heard about the epidemic of crystal meth. Crystal meth is playing a direct part in the transmission situation,
Yeah.
because it's a sexual drug that brings out sexual whatever it brings out. Everybody's having sex. Everybody's having sex. Now, are they having safe sex? No, they're not. But people are dying. They have HIV when they die, but that's not what they're dying from. They're dying from depression. They're dying from drug overdoses. They're dying from being poor and uneducated. So a lot of these things now, before AIDS was, you had AIDS, this is what it was. And at the time, 20, 30 years ago, we wasn't attaching education and poverty to that. We were talking about it, but now it's almost like they run together. They run together. There's no way you could talk about HIV in a black community without talking about education and poverty. There's a dysfunctional family, the father not in the home. You know what I'm saying? All those things are what makes a great ingredient of disaster. And Newark was the perfect city for disaster. Where in pockets amongst the black people. You got the black church that telling you Jesus don't love you because you ain't worthy and the pastor's sleeping with you. So it's not all, but some. Let's keep it 100. Come on now. And that's what was going on. And Newark is still, to this day, one of the hardest cities to crack as far as communication about any sexual situation.
And the thing that I was seeing at St. Michael's, with one of the largest HIV clinics in the country, was because of the stigma, people coming into treatment so late that they were so sick that you couldn't, the medications are going to work and salvage your immune system at some point. But if you come in too sick, you were just too sick and you would die. And so we still see the deaths. But what's killing people is the stigma. Because there are effective treatments, but we're still dying of the stigma.